Manitoba nurses and nurse practitioners are turning to private agencies for a better work-life balance and safer working conditions. And that could be impacting patient safety. CTV's Daniel Halmarson explains.
More nurses than ever before are working for private agencies in the province. That's according to a recent report from the College of Registered Nurses of Manitoba, showing 1,610 nurses opted to work for private agencies in 2024.
The number one finding, with very few exceptions, really was that people were seeking, greater work-life balance, the ability to have more flexibility in managing their schedule.
Agency nurses commonly work in emergency rooms, general medicine wards, and long-term care settings, filling gaps in the public sector, especially in rural and remote areas. The report says while agency work does help address staff shortages, the college warns of risks to patient safety and healthcare system stability.
Emergency rooms as a setting for agency nursing is new, and that's certainly a concern, especially if you have inexperienced nurses working in a very high acuity patient care environment.
The opposition Tories health critic says this report reveals nursing practices in Manitoba are heading in the wrong direction.
It points to an increasing reliance on agency nursing, and it states that the primary reason for that is a shortage of acceptable working conditions in the public system, and that's what should make the minister's ears perk up.
The provincial government has come up with solutions like the provincial travel nurse team in order to attract more nurses with pay and perks to fill shifts. But the head of the Manitoba Nurses Union says the NDP government isn't adequately funding or resourcing the team.
They put their application in and then they hear nothing for 4 months. So we have gone to the government and we have advocated very loud and very clear that we need that team resourced to be able to onboard those individuals very quickly.
Daniel Halmarson, CTV News, Winnipeg.
The Manitoba government has issued a request for proposal to cap the number of agency contracts and improve oversight. And earlier this year, the College of Registered Nurses introduced new guidelines for agency practice. Now, that includes requiring nurses to have at least 2,015 hours of experience in a Canadian healthcare setting before they can take on agency work. CTV News has reached out to the health minister, but we haven't heard back.